Dr. Tash, welcome.
Thank you so much for having me on today.
We are so incredibly inspired by the incredible work that you're doing with LGBTQ plus youth, particularly your advocacy in this area. And I think I would love to start with just your journey on this path. What led you down this path?
That's a wonderful question. I love knowing the reasons why people do what we do. And as psychologists, I think that we all have niches of what interests us specifically. So I am a pediatric psychologist by training. My passion lies in helping youth with chronic illness. And when we think of chronic illness, it's one identity. I talk a lot in the hospital that kids have so many identities, and a chronic illness is one of them. So when I think of all those identities, I try to really learn about which kids are most at risk for poor mental health outcomes and how can I help change that and improve their lives. So my training was mostly in the Midwest and Northeast. And then when I moved to Miami, Florida, where I'm currently located, I saw and read about a lot of horrible things happening to LGBTQ plus kids at the legislative level. So that's where my advocacy and my passion was fueled of how can I improve this and how can I debunk a lot of misinformation, which is a big issue that we have, particularly in mental health and medicine. And then from there, it just skyrocketed because the more I fell into it, the more I saw how there's so much change and improvement that can happen with such simple things. And it starts with conversation and education. And that's what led me to where I am right now.
Oh, that's incredible. Those barriers that you talk about for our youth, what are some of the barriers that you've come across?
Particularly LGBTQ plus youth.
Mm, mm-hmm,
LGBTQ plus youth face many barriers, and it starts at even like the bigger macro system of what's happening in the world, socially, politically, legislatively, and then within different countries, within different states. And then when we have laws and bills that are discriminatory, that are excluding LGBTQ plus youth, they're going to feel a lack of acceptance, a lack of inclusion. They have a lot of barriers in terms of physical, like medical care and mental health care. A lot of providers are not really versed on how to have conversations around gender and sexual diversity. So when the adults in your life aren't able to talk to you about how to best take care of you, you can feel really lost and you're not having attention given to what your needs are. And within that, I'm sure we'll talk about school. And
mm-hmm.
school is where kids spend the majority of their time. So when we have schools that are not inclusive or that are discriminatory, there's a high increase in bullying, a high increase in feeling internalized symptoms of depression, of anxiety, of trauma. And then all of those are what we call the minority stress theory that we see happens in LGBTQ plus youth, where they can have these internal stressors about my identity, the lack of acceptance, and then the external stressors of I don't have the same rights as others. I am discriminated. I'm constantly stigmatized. I'm left out. I'm excluded. I'm not accepted.
Mm-hmm, mm-hmm. Dr. Tash, I can just imagine, growing up for anybody going through different developmental phases is difficult and tricky. I think when we add on that extra cloak of who I am is not acceptable to others, I can't even imagine how difficult it is for our youth.
Yeah. Yeah, to get the message as a child that who you are is not okay and is not accepted and to feel excluded, that's one of the most heartbreaking things and almost also one of the most difficult things for a child to accept. So it will have impacts on how they feel about themselves, how they view themselves. And from there, we see what I talked about just now is that lack of acceptance and these non-affirming environments. And that's why we see a very high increase of depression, anxiety, suicidality, and homelessness among LGBTQ plus youth. So all the things that we try to give kids so they can be successful are significantly lacking among LGBTQ plus youth.
Mm-hmm, mm-hmm. It's so interesting. I think right now there's this wave of compassionate parenting, gentle parenting, present parenting, whatever we want to call it, right? There's this whole wave of like seeing children for who they are, validating who they are. But I think when we look at larger systemic issues, we're just still really failing as a society.
Yeah, and it's unfortunate because we also see patterns in society where maybe for 2 years there is increased inclusion and acceptance, and then the next 5 years, there's a significant decline and there's an increase of violence or hate crimes or really negative, ugly rhetoric around certain identities. So even those fluctuations can send such mixed messages to kids.
So harmful. So where do we start? Where's the kernel of hope here? What do we do?
As parents, there's a lot to be done. And that's where I really, the thing I like to focus on is that while we know there are these very significant mental health disparities among LGBTQ plus youth, including those external factors that we talked about, the discrimination, the stigma, the lack of acceptance, LGBTQ plus youth are tremendously resilient and they do a wonderful job of advocating for themselves. So I like to take a strengths-based approach, particularly with parents. And there's so many things parents can do. And it starts with very simple things, just like you talked about that compassionate parenting of opening conversations with your kids where they feel that they can come to you and there will not be judgment. When we create that safe environment for our kid to come and talk to us about how they feel, what they're thinking, who they are, what they're worried about, that allows a parent the power to not only be the support, to be the person that's present with them, but to also be the person that can educate them. And I say that with a grain of salt because we also want to know, we also make sure that we are not just listening so we can educate, we're listening to try to understand. And then parents can take that information and educate themselves.
Mm-hmm.
Simple things just about how do you define gender identity, gender expression, sexual orientation? What are the differences? Even listening to this podcast, what are LGBTQ plus youth experiencing? So to break it down into some points is educate yourself, learn about gender and sexual diversity, listen without judgment, create that open communication and environment with your child, and model inclusivity. Meaning, if you hear anti LGBTQ rhetoric, whether it's on TV, at a school board meeting, just picking up your kid from school, stand up and say, like, that's not okay. We don't say those types of things because they're very harmful. And in our family, we love and accept all kids and all people,
Mm-hmm.
you know.
Mm-hmm. Oh, so beautiful. So it's not just having those conversations with your kids, but it's actually how you approach your world.
Right. Right. And modeling for kids is everything. What kids see and hear from parents and adults, that sets the stage for how they're likely going to interact with their peers.
Mm-hmm. Mm-hmm. Dr. Tash, one thing that I hear from so many parents and what I love with what you're saying here about educate yourself is that there seems to be a lot of confusion over what to do when their child does come to them and say, mom and dad, I'm identifying differently, or I would like to be called by whatever it might be. I hear from lots and lots of parents that they have no idea how to approach those situations.
I hear that from a lot of parents too. And what I quickly do is validate because regardless of any identity or any experience that may be challenging for your child to come to you and talk to you about, it can be hard as a parent. There is not always a right thing to say. I say that as a psychologist, where people come to me thinking I'm going to have the right thing to say. And what I talk a lot about is it's not right or wrong. And that's the same with gender. It's not binary. It's not male, female. It's not this or that. It's not black. It's not white. There is a spectrum of responses. So there are main things that we want to focus on. If your child comes to you and asks questions about their identity, is saying, this is how I identify, I'm figuring this out, I want support, parents very quickly validate their feelings, listen to them, and say, I love you and I'm here with you, and we will figure this out together. Something that I see oftentimes is parents will become silent. And what I say is that silence can be very harmful when a child comes to you and wants to hear, I'm here with you, I'm in this experience with you, and I'll support you. So silence can be extremely harmful. It's very simple. It's I hear you and I love you and I'm here with you. Even for parents that I've worked with, that it's a little bit more challenging because of other beliefs, whether it's religion or personal or generational, is saying, this is new for me. I'm going to learn about this and I love you and I'm here for you. You're recognizing your own experience and you're validating theirs and supporting them.
Oh, it's so beautiful. It just brings in kind of little bit of the messiness of being human there. It's like, okay, this is totally new. This is also challenging for me, but I love you, and I think that's how we create a safe space for our kiddos, is to go, I'm here. Like, it doesn't matter what you tell me, I
Right.
am here and I'm with you in this.
Right. It's what I talk a lot with patients of. If I model that their distress is intolerable, it will feel intolerable for them. When we sit with patients, when we sit with kids and something that's so distressing, being with them and tolerating it shows like, wow, okay, even though these are really big emotions, my parent is here with me and I'm not alone. And if they can sit here with me, we can do this together.
Hmm. And I think, Dr. Tash, that's the wish of any parent, is that they don't want their child to feel alone.
Right.
Yeah, I think that's at the heart of it, even
Yeah.
in those really confusing moments for parents.
Definitely. And I think for parents is feeling connected to your child. What I tell parents is that if you don't create this environment, who will your child go and talk to, or where will they find information? Because there's a lot of misinformation out there. And I empower parents because I tell them if you want to be the person your child comes to and you're the one who talks them through and gets them accurate information, such as things about gender affirming care or about LGBTQ inclusive care, connecting them to physicians, to psychologists, advocating for them at school, they need to be able to come to you as the adult that they trust and that you know that my child is safe because they're coming to me. They're not going out to somebody else seeking this information or validation.
Makes so much sense. Dr. Tash, you mentioned gender affirming care. Can you talk a little bit about that?
Gender affirming care has gotten so much coverage recently, particularly about what's happening in the US and different states with trying to ban it. And in a lot of states, including Florida, for pediatric patients, it has been banned. Gender affirming care is a term that encompasses a lot of different types of interventions. At its root, it's a team of professionals that are multidisciplinary, meaning they're psychologists, social workers, endocrinologists, pediatricians, um, different types of specialties that come together, and they have a high level of understanding and education on how to create inclusive environments that we just talked about and how to help talk to parents and youth about where they may be in terms of whether it's gender identity struggles, concerns, wanting to understand their gender more, if they're looking to get into gender transition. It is so unique. That's what I tell people. I'm not sure if you all saw the interview with Jon Stewart. I thought it was very powerful, where he talked about gender affirming care is not a 9-year-old going into a clinic and getting hormones. And that's unfortunately the narrative that's been pushed. That's absolutely not what it's like. It's a team of experts that will meet with a family multiple times and talk about what is best for them as a family for their child next. And when we think about gender affirming care, there's a few pillars. So there's like the social interventions where we can talk about gender social transition. There's more of the endocrinological, which can involve the puberty blockers, hormone replacement therapy, and then further down is the surgical intervention, such as gender affirming surgery. Another thing I really want to make sure to say is that gender affirming surgeries are very rarely performed on minors under the age of 18. So there's been a lot of misinformation about that. And like I said, while this sounds linear, if someone is looking to understand their gender more and they may choose to transition, it is so unique to every person and every family. And there are so many stops along the way with physicians, with psychologists, with a whole team of professionals.
Mm-hmm. And Dr. Tash, just as what you were saying earlier about parents being with their child's heart, this is what I'm hearing too, is that this is a team of people who are with that family's heart and say, what do we need? What is that journey going to be? What supports do you need in place? This isn't just what the mainstream media might be leading people to believe, that this is surgery and it's change for kiddos. It's something very, very different altogether.
Right. And what I talk a lot about is that we live in a very binary world, meaning we see things, like I said earlier, as like 0 or 1, this or that, yes, no. And the big thing for parents, if they want to try to understand gender and sexual diversity, is to remove that binary thinking. Understand that we all exist on a spectrum that includes gender and sexuality. So we can't place people in these categories. And I think what's happened is We've gone from male female, where we've evolved a little bit, and now it's cisgender, transgender. And that still is binary. There's a whole group of folks that are, whether it's gender diverse, gender queer, gender expansive, because people are on this spectrum. So if someone goes to a gender clinic, it also doesn't mean that they may get any type of medical intervention. They may simply want a consultation so they can understand their gender more and explore in a way that's safe.
It's beautiful. And I think just again sees the human being behind all of the hype that's out there and goes, who are you as a person? How do we help you to be the best version of yourself that you want to be in the world?
Exactly. And who you feel comfortable being and who your identity will help you thrive. If we're not comfortable with ourselves and we can't be our authentic selves, it really sets us up for a very difficult road in the future.
Dr. Tash, you mentioned, you touched earlier on schools. Here in Alberta, schools and gender are a big thing. What are your thoughts on how our schools can help our children?
Schools could be immense support for kids. They can also be very stressful for kids. We know the majority of days spent for kids are in schools. So schools can serve as a huge platform to help with education, also about people's identities. For schools, the main things I say are creating those inclusive, safe environments. Unfortunately, what we've seen in states like Florida, where I'm in, is those safe spaces are gone. And that's really challenging. And what I mean by safe space is what schools can be doing. They can be creating anti-bullying campaigns that also include zero tolerance for anti-LGBTQ rhetoric, behavior, bullying. Setting the tone for this is not acceptable and this is not okay in our school right off the bat. Ensuring that we are honoring and respecting adolescents' pronouns. So affirm name, affirm pronouns. I know this is also can be challenging for some people because they're like, well, this is my natural language is I just say the pronouns that I associate with whatever gender I assume of the person in front of me. We can simply ask, not assuming, asking, and then honoring those pronouns and that name. Other big things that have come up, particularly in the US, are all gender, gender neutral restrooms in schools. While in theory that can seem like a good idea, and we should have those restrooms available for all students, not just those that are gender diverse, also having conversations with the school about this is my child's gender identity and allowing them to use the restroom or the locker room that aligns with their gender identity, as opposed to forcing people to use a restroom they may feel so uncomfortable in. And I'm going to pause right here because oftentimes what I hear is people saying, I don't want a boy in my daughter's bathroom. And while I hear what you're saying, I can assure you that that child is not looking to be a threat to your child. You're making an assumption that a child is perverted or is looking to do something hurtful, which they're not. This is about them. This isn't about them trying to harm your child. Imagine the discomfort they're feeling. And imagine how strongly they realize this is their gender identity if they're wanting to use that restroom. And there is no data that shows that someone using a bathroom that is aligned with their gender identity shows any type of increased sexual violence towards others. But again, as people, these are the belief systems we tend to have in our society. So we need to be open to understanding and learning this. And that's the same with schools.
Yeah. Dr. Tash, what are your thoughts? Because something that we often hear here is that gender is something that shouldn't be a part of schools for kids. That's an individual family decision. We shouldn't be talking about gender in schools or being open to gender inclusive practices. What are your thoughts on that?
Many thoughts. First being that we have been talking about gender in schools forever, right? We talk about the boys line up here, the girls line up here. This is the boys' restroom, this is the girls' restroom. Buddy up with a partner for this assignment, they need to be a group of all girls, a group of all boys. So if you think about it, gender has always been ingrained in our society in the binary views that we have, and that's the same in schools. So I will say, I think it is an art to balance the safety of students in terms of if they are or are not out to a parent, the laws of the state, which we have to abide to, and balancing those things to keep the child safe. A lot of things can be case by case basis, depending on where a child or adolescent are. So I give the example that if a family knows of of their child's gender identity and they would like to advocate for them at school, those are conversations to have as a school to see what can we do to support this family and this child. And I think when that comes into play, if schools are devoted to the education of children involving how they learn about themselves and their thinking patterns, their worldviews, is our responsibility to do that. Now, much more difficult situations that are a little more complex are if a child says, this is my gender identity and it doesn't align with my sex assigned at birth. And please, my parents don't know. They will absolutely kill me. I'd be in danger if they find out. That is where it needs to be case by case. And it needs to be a more intricate discussion of, okay, how do we keep this child safe at school and at home?
Mm-hmm, mm-hmm. And really working as a community, like that safe community around the child. We surround the child.
Right?
Oh, it's my dream that all children have that because I don't think all of our kiddos have that yet.
Well, sometimes, yeah. And sometimes the example I use is imagine being on such high alert all the time about who you are. If someone learns about it, that it's not a safe person. If someone's going to bully you or harm you. And imagine now being in school, having all that anxiety, those thoughts, those worries. Of course, it's going to be hard to concentrate and learn. And then things continue to get tougher and tougher. If we're not academically successful, we're not learning, we're falling behind. So I don't know why we would ever want to put this on kids. Kids have so much going on. I say being a teenager right now is probably the hardest thing in the world,
Absolutely.
along with being the parent.
Yeah.
So why we can make things easier for both parents and kids
Mm-hmm.
if we can be open to conversations. And that's where the psychologist in me really comes out because so many things have happened, particularly over the past few years, that have really shifted us as people, where it's me against you. And I don't know why we've become like this. And this has also been taken out, particularly on the LGBTQ community. My hope is that we start to disarm ourselves and we realize if our goal as educators, psychologists, parents, adults in the world is to keep kids safe, we should be listening to the experts, we should be looking at the data, and we should be creating policies that do that. Unfortunately, what I've been seeing in the US, particularly in southern states, is the exact opposite.
It's devastating. Yeah. Dr. Tash, from my side, I have one final question. So we look at this, what's happening on a wider kind of systemic level within our families. How do we start opening up the conversations around gender? Is there a certain age that that's appropriate? I know many parents have that question.
Gender is something that develops pretty early on compared to what most people would think or expect. I'm not sure on what information, but we see that usually by age 4 and 5, kids start to label themselves with a gender. The kids will make the declaration like, "Oh, I'm a boy," or "I'm a girl," or we see more diverse gender expression in kids. And same with like toys, right? We see that just because someone who was assigned female at birth, it doesn't mean that they can't play with monster trucks or they can't throw the football. We want to create a world where these things are okay. Toys are not gendered. Activities are not gendered. So the conversation can start pretty early on with it's not even asking, it's again the modeling of, yeah, of course you can play with the football. Play with what feels good and right for you. And just modeling that allows a child to see that, oh, it's safe and it's okay for me to express myself in the clothing I wear and how I style my hair and the activities I participate in and the friends I make. And that starts pretty early on. Like I said, when kids start even going to like preschool or kindergarten, that journey begins. And I say journey because it is a journey. It's not always going to be linear. And while I said gender is on a spectrum, there's also fluidity where some people, they may not feel okay to come out about their identity until later on in life. For some people, it's earlier on. So parents modeling this inclusive behavior and this language, I would say starts pretty early on. I would say like pre-K.
Hmm. Hmm.
And we know that, oh, I was gonna say, we know that with adolescents, that's when we see a lot of um, like segregation in sex-based hormones. So that can bring up a lot. It's also within the context of adolescents are in this identity development. They're in this time of life where they're trying to develop this autonomy. And we see that with changes in their hormones, that creates a lot of changes within them. So those conversations will probably be more in depth, will be more specific as a child goes into adolescence.
Hmm. And I think what really resonates for me there is I think so many parents go, they're just children. We don't need to be talking about gender and sexuality at such a young age. But what you're saying here is that it is, again, on a spectrum. So we start with just saying everything like who you are is exactly who you need to be right now. You can be Spider-Man, you can be a Barbie, it doesn't matter. What do you want? And then we develop the conversation from there. Again, I think there's this view that it's like all or nothing, which isn't true.
And it's that binary. It's like it's all or nothing. I have to have a conversation about whether it's gender identity or sexual orientation at 13 because that means they're a teenager. We also know that 13 is no longer the age that kids are experiencing puberty. So we have a lot of information that it's just become the way we see the world. And we have to recognize that the world has evolved and changed just as we have as people. So in order to keep up, we have to be open to understanding the science, to understanding the power of non-judgmental accepting spaces. And we have to start going from there.
Hmm. Beautiful. Dr. Tash, any final words for people listening in today?
The final word I always give with any talk that I do is if you've listened to this podcast and you've listened to me speak, and there's one thing you can take away from this, is that there's a lot of data and evidence that shows that one accepting adult can reduce suicidality for up to 40% in a young LGBTQ person's life. When we talk about suicide prevention, we do so much to aim for that. And yet, are we missing the most basic thing, which is that when we accept people and allow them to be their authentic selves, we significantly minimize their risk for suicide. So, all the stuff we just talked about, non judgmental spaces, modeling inclusivity, showing acceptance, I'm here with you, I love you, I'll learn more for myself, that can reduce suicidality almost by half.
Wow. That statistic just gives me goosebumps.
Yeah.
Yeah. Dr. Tash, where can our listeners find you?
So it's Dr. Tash with an A. You can find me on Instagram at dr underscore Tosh P.
Hmm.
That's the same for X, formerly known as Twitter.
Hmm.
You can also check out drtosh.com to get a lot more information.
Beautiful. And we will put all of the links in the description too, so people can just click right through.
Perfect. And if you also want to write my email, it's info@drtosh.com.
Wonderful. Excellent. Thank you so much.
Yeah, that was wonderful. Thank you.